Hi everyone, and welcome back to my YouTube channel. I hope you all are well today, and I hope you all are taking good care of your health. Thank you for stopping by. Thank you for watching this video. If you are new, special welcome and thank you to you. I am Regina Mmadu, a pharmacist. In this channel, I'll be discussing about diseases, treatment, preventions, causes, and overall health-related topics. So if you're interested, click the subscribe button and also click the bell icon for weekly updates. In today's video, I'll be discussing about epilepsy. I'll be discussing about what it is, the causes, the symptoms, the types, the treatment, the preventions, and triggers. So don't skip this video yet. Watch it to the end to gather all the informations. Let's dive in properly. What is epilepsy? Epilepsy is a chronic, non-communicable disease of the brain. It is characterized by episodic seizure. This seizure can range from few minutes to few seconds. You cannot talk about epilepsy without mentioning seizure. The symptoms of epilepsy is not all epilepsy is characterized by that vigorous jerking movement of the muscle that leads the person to fall down, and it will seem the person is struggling with life. It's not all epilepsy that will lead to that. These symptoms are loss of consciousness or awareness, that the person will be unaware of their environment, anxiety and depression, and that is because of how this episodic seizure happen, because you cannot predict when this episodic attack will happen. It can happen in public places like market, school, on your way. It can happen anywhere, maybe when you are in the kitchen cooking. And that unpredictable episodic occurrence of epilepsy leave these people with fear, with anxiety, because they don't know when it will happen, and that will reduce the quality of life these people live. It will reduce their socialization, and that is what leads to anxiety and depression. Another symptom is sudden stiffness of the muscle, like someone will just stiffen all of a sudden and then fall. Another symptom is sudden both blinking or showing with no apparent reason. Another symptom is movement impairment. Another symptom is loss of sensation, mood, or other cognitive functions, which includes hearing or seeing. Another symptom is fainting accompanied with loss of bowel movement and bladder control. That someone fainted, and before they wake up or before they become okay, they have wee and poo at the same time. Another symptom is convulsion without fever. That means someone is convulsing, but they don't have high temperature. This doesn't mean that these symptoms I mentioned are exclusively for epilepsy. There are other conditions, there are other diseases that have these similar symptoms, such as cataplexy, narcolepsy, neurological infections, fainting, panic attack, fugue state. That it is a condition where someone lost their memory and unaware of their identity. And psychiatric seizure. It means that there are some psychiatric conditions that is accompanied or have symptoms of seizure as well. So the best way to know whether you have epilepsy is to go for diagnosis. And also, that doesn't mean that if you have seizure at one point in time in your life, that means you're epileptic. No. What are the types of epilepsy? Categorically, there are two types of epilepsy: generalized epilepsy and partial epilepsy. In partial epilepsy, there are two types, which are simple partial and complex partial epilepsy. The difference is the symptoms. You can differentiate it by the symptoms. In partial epilepsy, it means that the seizure is generated at one point of the brain or in one part of the brain. It's kind of fixed. So, you know, the brain is in two hemispheres. Okay, so in partial epilepsy, it means that the seizure or the abnormal electric signal that is sent which leads to this seizure episode, is generated in one part of the brain and it affects only that part. In simple partial seizure, these people, during the episodic attack, which is a seizure, they are aware of what is happening. They are aware of their environment. Okay, it doesn't go with unconsciousness. In complex partial, these people have impaired consciousness. They can lose conscious, or they will be partially aware of what is happening during the episodic attack. In generalized epilepsy, this type of epilepsy affects every part of the brain, though it is generated at one point at a particular area of the brain and then it spreads to other parts. It's just like when you have a water in a bowl or in a container, you dip a stone, or you just throw a stone or a bead inside. You see how the wave will spread all over inside the bowl. That is the example I can use to explain it. It started at one point of the brain and then it spread to other parts, affecting every part of the brain. It is divided into tonic-clonic. Tonic-clonic is also known as grandma epilepsy, and it is the general one we all know about, that is accompanied with jerking movement of the muscles, stiffness, loss of consciousness. And then we have atonic, which is characterized by loss of muscle tone and loss of consciousness. We have clonic, which is characterized by stiffness of the muscle followed by fall. And then we have tonic, which is characterized by jerking movement of the muscle of the arms, of the legs, and of the face. Another type is myotonic. This involves the twitching of the muscle of the upper part. Twitching means like the muscle is drawing itself, especially in the upper part of the body. And then another type of epilepsy is secondary generalized. In this, it is combination of generalized and partial. It means that it started from one part of the brain. It started as a partial epilepsy and then become generalized. If the symptoms, or if this seizure episode lasts longer than it should, it can even lead to death, because during that episodic attack, and if it lasts longer, it will cease function of other organs of the body, leading to death. That is if the epilepsy is not under control. What are the causes of epilepsy? Generally, there is no specific cause of epilepsy, though there are some that are caused by underlying diseases. The different causes of epilepsy are tumor in the brain injury or brain trauma, which can be as a result of accident or a fall. Another cause of epilepsy is genetics. Yes, in some people it runs in the gene, it's found in the gene. That means that some genetic material of individual is impaired, like it's not proper, it's not the way it should be. Another cause of epilepsy is congenital abnormalities. In this, during the development of the fetus in the womb, maybe some part of the organs, due to one's condition or the other, or due to the health of the mother, the baby organs, some of the organs of the fetus is not properly developed. If this maldevelopment occurs in the brain, that will lead to malfunction of that area. That is congenital abnormality. Another cause is perinatal injury. That is during delivery or during the pregnancy. If there is injury that occurs to the baby, then this can lead to epilepsy. Another cause is infection or neurological infection, such as meningitis, encephalitis, or shingles. That is infections that affect the brain. Bacterial infection that affect the brain or nervous system in general can lead to epilepsy or seizure or convulsion. So what are the treatments? There is no cure for epilepsy. Currently, epileptic treatment is symptomatic treatment. The treatment is not to cure it, but to control the seizure episode. And with drug, this seizure, which is the bad of epilepsy, can be put under control. So To some extent, when the drug is given, these people go seizure free. That means the epilepsy cannot interfere with their day-to-day life, and they will live normal. And before this can be brought under control, they have to take this drug for a long period of time. The anti-epileptic drugs used in treatment of epilepsy are valproic acid, carbamazepine, lamotrigine, and phenytoin. These are the most popular anti-epileptic drug used. It's usually a tablet and it's taken by mouth. Some people have epilepsy, but the frequency or the occurrence of seizure is not much. Maybe once in a year, or twice in a year, or 3 times in a year. So this people does not require treatment. But whereby the seizure occur every day, or several times in a day, or several times in a week, or several times in a month, then must treatment have to be taken. If you have epilepsy, you must have to work with a healthcare provider, because based on your overall health condition, based on the type of seizure or epilepsy you are suffering from, treatment will be given. In the case whereby this episodic seizure is not controlled by drug, then surgery is another option of treatment. And the different surgery are lobectomy. In lobectomy, this portion of the brain where the abnormal signal is generated is removed. What happens in seizure is that this part of the brain where the seizure starts from send abnormal electrical signal. The nervous system is just like electrical wire or electrical circuit. The neurons are like the wire that carries the current. So this in seizure, this part of the brain where the epilepsy is generated sends abnormal signals to other part of the body, which is carried by the neurons, sending those abnormal movements and all that. Another type of surgery is hemispherectomy. In this type of surgery, one hemisphere of the brain is removed surgically to prevent the epilepsy from spreading, or the abnormal signal from spreading to other part of the brain. Another surgery option is multiple subpar transection. In this, multiple cut is given to different areas of the brain, and this will limit the seizure from spreading to other part of the brain, because this cut will kind of put boundaries. And because of this boundary, when the seizure is generated, it cannot easily transfer to other part of the brain. Another surgery option is corpus callosotomy. The brain is made up of 2 hemispheres with connection that is joining them together. In this type of surgery, this hemisphere is separated so that seizure from this part of the brain cannot easily transfer to this part, or from this part of the brain cannot easily be transferred to this side of the brain. Another treatment option is implantation of device in the chest with pre-programmed electrical signal. So with this device in the chest with pre-programmed electrical signal, whenever epilepsy or seizure seems to be generated from part of the brain, they will put their own signal, they will generate their own signal, so that the abnormal signal sent by the brain will be stopped. Another treatment option is change of diet. Study shows that ketogenic diet helps a lot in improving seizure. That is eating fat containing food. What are the trigger? What usually trigger epilepsy are 1, stress, 2, flickering light, and also lack of sleep. Lastly, I'll discuss the key facts about epilepsy. It's just like general discussion. Number 1 is that epilepsy is chronic, just like I said in the beginning, is chronic non-communicable disease of the brain. It's chronic because it's not something like that will last for 1 or 2 weeks or 1 month and then you become fine. It's a lifelong disease. And non-communicable because it is, you cannot get epilepsy from someone and someone cannot give you epilepsy. So don't discriminate them. Don't separate yourself from them, because you're not going to get epilepsy from someone who have it. Number 2 is that 50 million people of the world population are suffering from epilepsy. Number 3 is that epilepsy affects people of all ages, race, tribe, and religion. It does not selectively affect people of specific religion or specific race or specific age. It can be you, it can be your family member, it can be anybody. Number 4 is that epilepsy reduces the life expectancy of the sufferer. Premature death in those who suffer from epilepsy increase 3 times more than the normal populations. Because this epilepsy, it can happen anywhere, like I said before. And just imagining driving and this occur, what will happen? Accident might occur and the person will die. Just imagine this person cooking and this episodic seizure occur. They might fall into the fire. Just imagine that these people are operating some engine or machine that are harmful and suddenly it happened. What will happen to them? Just imagine that this person is crossing road and all of a sudden the seizure started. They might fall on the road and motor can jam them. So all this danger of falling anywhere, because it's unpredictable, endanger these people's life. Another thing is that 80% of those suffering from epilepsy are living in low to middle income countries like mine, where there is no good health care or where the family doesn't have high income to take care of this person who is suffering from epilepsy. And because this people doesn't have enough finance to treat this individual properly, or because this country is middle or low income country, these people doesn't have access to good treatment, and this will make it even worse for these people. Another thing is that 70% of people with epilepsy live seizure free. It means that these people will rarely have seizure, though they are epileptic, but there is no seizure. Even though these people have seizure attack in the first place, with drug it can be controlled and they will live normal life. But because 80% of them are living in low to middle income countries, they don't have access to good treatment, making it even worse and endanger their life more. And that key fact is this: epilepsy is stigmatized in our society. Right from time, epilepsy is stigmatized, but we are advanced enough to let go of this stigma that is attached to epilepsy. Not just the person who suffers it, but also their family member or their relatives. What I'm trying to say here is that you watching this video and you have some kind of view about epilepsy, please take it off your mind. Epilepsy can affect anyone. Don't discriminate these people. Don't dissociate from these people. Don't judge these people. Instead, support them. Treat them like every other person. Okay? And because of this stigma, people don't come out or discuss what they are suffering or what their relatives suffering with someone. I'm not saying that you should carry a microphone and come out and be announcing that you have epilepsy, no. But if someone seems to care, open up to them. Reason being that you don't know where your help will come from. The person that you might open up to might have a solution to your problem, or even if they don't have the solution, they can direct it to someone who can help you out with the situation. Another fact is that people do have physical injuries like bruises, fracture, because of how it does happen, the sudden fall that do come with seizure episode. Another thing I would like to say is that if your family member is having epilepsy, support them. No matter how frustrated you may feel, don't unleash your frustration or your anger on them, because it will add to what they are suffering already. Instead, shower them with love. And if a family member or you are having epilepsy, don't sit down and wait for the day you will die because you think you cannot be useful to yourself anymore. You will be denied access to many things, or you cannot do anything meaningful with your life. No. Instead, start treatment. Look for options. Start treatment as soon as possible instead of leaving it to be worsened and waiting for the day you will die of epilepsy. No. Or wait for yourself to suffer all the pains because you think there is no option for you than to suffer it. Get medication. Start your treatment as much as you can. Maybe it's a child or your maid that is having epilepsy. limit them from doing some certain things like going to fire or going to the river or water alone or by themselves if no one is there to rescue in case if the episode occurs. Kudos to all the people who are suffering from epilepsy and have been standing tall and not allowed this disease to ruin them. I hope you all enjoyed this video. Please, if you do, give me a thumbs up, subscribe to my channel, share my video, and also leave your comment on the comment section below. You can comment what you call it in your language on the comment section below. And like I said, it's incurable. If there is anybody you know, or if there is any cure you know by other alternative medicine other than English system of medicine, you can also comment on the comment section below. And if there is any suggestion you have, you can also comment it on the comment section below so that others will read and benefit from it. Thank you for watching, and do have yourself a good day. Bye bye.